Could you explain a bit about the dangers of antimicrobial resistance?
Yeah, antimicrobial resistance, or AMR as it's frequently referred to, is a little bit like hypertension is in clinical medicine. In clinical medicine, people don't realize they have high blood pressure and then something really bad can happen. And in the same way, antimicrobial resistance is something that still very few people understand about. But basically what it means is that we're losing the ability to treat infections because the medicines used to treat the infections are becoming less effective. And that's because the different pathogens out there are genetically changing over time to become more resistant to the medicines. The implications of this are enormous. We rely upon antibiotics to treat infections. We rely upon them when we have large operations to protect people or when people are immunocompromised. But we also rely upon them for our food supply. It has a huge role to play in food security and food supply. So there has been some recent work done looking at the numbers of deaths from AMR. And so one of the really sobering projections coming out of that work is that by the year 2050, we can expect to see as many people dying from antimicrobial resistance as we can from cancer. That's around 10 million people per year. And so that's an enormous figure. And that's something which is developing as we speak. And so it's a very large problem, but it's a problem which is probably under-recognized by most governments.